I'm sure you've heard young adults or young adolescents or even children getting diabetes and you're wondering what it is. Yes, it's called juvenile diabetes. In this video, we are going to talk about the causes or the risk factors, the signs and symptoms, and how to manage it. Please, if you're new on this channel, my name is Dr. Saki. You can call me Dr. Adams. Do not forget to subscribe. Thank you. Time with Dr. Adams. Hi there. Welcome to another episode of Time with Dr. Adams. Today we are talking about a condition called juvenile diabetes. In the past, we used to call it insulin-dependent diabetes. If you ever hear someone mention that phrase, it also is juvenile diabetes. If you've ever heard someone talk about diabetes type 1, it's also the same thing as juvenile diabetes. So what it is a chronic condition, an autoimmune chronic condition. In our bodies, we have an organ called pancreas. Now, pancreas is responsible for producing a hormone called insulin. Insulin is supposed to transport glucose or sugar into the cells of our bodies to produce energy. So people or children or young adolescents or young adults with juvenile diabetes, it means there is a problem with their pancreas. So their pancreas is either producing little insulin or no insulin at all. I repeat, people with juvenile diabetes have chronic conditions where their pancreas is refusing to produce insulin at all or is producing little insulin. Now, insulin is the hormone that is responsible for transporting glucose or sugar into the cells of the body to give us energy. So in such people, their pancreas isn't working at its optimal level. Hence, they have lots of excess sugar or glucose in their system. Understood, right? Now, what are the causes? It's an autoimmune disease or condition. It means the body itself is mistakenly fighting against the pancreas. It happens, and that is what we call autoimmune disease, self-destruction. So your body itself is fighting against the unit of the pancreas. All right, so you are not producing enough insulin or none at all. Also, some infections can cause this, or even chemicals can trigger this autoimmune disease to start. What are some of the symptoms? There are a lot. Increased thirst, weight loss, blurry vision, nausea, vomiting, abdominal pain, increased urination, yeast infection. There are a lot, but you can have some of these. Please, if you have a child or you know someone with these symptoms, it doesn't necessarily mean they have it. We are in Harmattan season. I'm a young adult. If I suddenly have this increase in thirst, does it mean I have juvenile diabetes? No. You should have other symptoms as well. And apart from these symptoms, probably I've also lost weight. I mean, weight loss can be a lot of things, starting from malnutrition. It also could be other things, but then it could also be a sign and symptom of juvenile diabetes. So with all these signs and symptoms that you are having, weight loss, blurry vision, increased thirst, vaginal yeast infection, and all that, go to the hospital. After telling the doctor your signs and symptoms, the doctor will make you do some lab tests. Fasting blood sugar is one of the things we do. And then we also have glycated hemoglobin. After these tests are done and you are diagnosed of juvenile diabetes, how do we manage it? I want to start off by saying that it's a chronic condition. Chronic condition means we are not going to give you medication for it to resolve in weeks or in months. It means you're going to live with it for the rest of your life. It's about how you are going to manage it. Because if you do not manage it well, you're going to have complications. There are people who have lived with juvenile diabetes for 20 years, for 30 years, for 40 years. It's all about the right management. So lifestyle change. It's going to be a multidisciplinary management. So you're going to talk to the dietitian, or the nutritionist to help you with the kind of foods you eat. Apart from that, we're going to put you on insulin. We have the short-acting insulin, the long-acting. Some come in pumps, others come in by injection. Your doctor is going to go through with you with all these things, going to explain to you all these things so that you live a healthy life. People or children with juvenile diabetes can't live a normal life. My youngest patients I've seen with juvenile diabetes that we refer to see a specialist. Yes, we have specialists in Ghana who can take care of such cases. The baby, I've forgotten, was less than 1 year. Yes, and he or she is doing so well because we referred him or her to the specialist. Okay, do not let anyone deceive you that they can treat you of your juvenile diabetes. No, there is no treatment. We manage it. If you manage it very well, you're going to live a normal, happy life. I hope I've answered our question. This question was asked by a viewer, someone who watches my channel. So if you also have any questions, if there's any topic you want me to go through with you, please let me know in the comment section below. I'm here to help. I'm here so that we all live our best lives. Thank you for watching. Do not forget to subscribe and share. Bye.
Time with Dr.